let's just wait and watch and see how you get on, and hopefully you get better. And as someone who is conditioned as a doctor to try and help people, that's really difficult to come to terms with. Hey guys, welcome back to the channel. My name is Kiran. I'm a junior doctor and a comedian working in Manchester. If you're new here, as always, make sure you're subscribed so you can join the team. As many of you know, I am a GP trainee. So GP training in the UK is 3 years of postgraduate training. So you do 18 months in a hospital, you do 18 months in a GP practice. I'm still in this 18 months hospital part, and so for the past 6 months I've been working in acute medicine. That means that if a patient comes in through A&E and they get admitted to the medical wards, one of the acute medical doctors will see them, will take the history, examine them, help make the plan, and then they'll come to our ward. So I have seen in this period of time of pandemic lots of patients with COVID, but I also do on-call, so I work at the weekend. And this weekend just gone, I was covering one of the COVID wards. So there was a consultant who was a respiratory consultant doing a ward round with me. And then when they left at lunchtime, I was covering the ward until 9:30 in the evening. And some of the things that I found there were a bit of a shock to me. I'm still trying to get around it, and I thought I would share with you some of my reflections of being the doctor on call on a COVID ward. As always, I'll put timestamps in the description if you want to skip around to the bits that you think are going to be important for you. The first thing that really shocked me was how young the patients were. I'd seen patients coming in through A&E that were old and that were young, and I assumed that all of the young people after a day or so were going home, and that wasn't the case. I would say that over half of the patients on my ward that weekend were between the ages of 50 and 60, and they didn't have a list of medical problems, maybe one, maybe two, sometimes none, and they were still really suffering with this disease, needing more and more and more oxygen. How young people were was a real shock to me. The second thing is something I knew, but something I didn't really appreciate fully until I was actually working on the COVID ward, is just how little we can actually do to fight this disease, and how much of it is, let's just wait and see how you get on and hopefully you get better. And as someone who tries to help everyone, that is a really difficult thing to come to terms with. If someone has a rip-roaring bacterial infection, so they've got a cellulitis, you can give them antibiotics and most of the time they will get better. If they've got fluid on the lungs, you can give them diuretics and get that fluid off. If they've had a heart attack, you can give them aspirin and thin their blood, and you can help that way. With COVID, it's just not like that. You can do a few things, but the difference that they actually make is not that much. And there's a point you reach where there's not much more you are able to do. So things we can do is that we can give oxygen. So people who have COVID, their oxygen levels are lower, so we can give them oxygen to supplement that. And using oxygen is quite useful because it's a marker of how unwell someone is. So if they're needing more and more oxygen, that's a sign that they're becoming more unwell. We can give them steroids like dexamethasone, which has been shown in people that are requiring oxygen to help because it reduces inflammation. And we can talk about positioning. So we can advise people to what we call prone, which is where they lie on their front, and that helps them with their ventilation and with their oxygen levels. Other than that, if they aren't getting better, the next step is quite heavy stuff. It's non-invasive ventilation, so having a mask that helps you breathe, or actually being put to sleep and having a machine breathe for you, so being intubated and ventilated. The problem with that is that is not appropriate for everybody. So that intensive care team will come and do an assessment and say, we think this may be an option, or actually this isn't an option at all. And usually their reasoning is, there's lots of other things going on, and the chance of you actually coming off that machine and getting better is just not there. So it's not an option for some people. So on this ward, we're in a position where we're doing as much as we can for people, slowly seeing them get more and more unwell. Some people get better, but seeing a lot of people get unwell and then getting to a point where we say, actually, there's not much else we're able to do. And as I said before, a lot of this treating COVID disease is saying, actually, let's just wait and watch and see how you get on, and hopefully you get better. And as someone who is conditioned as a doctor to try and help people, that's really difficult to come to terms with. And you feel so helpless. I think that's the main thing, that you feel so helpless when you're trying to treat these people. The other thing I noticed while working on the COVID ward is that the attitudes of patients were different towards staff. So I've worked in acute medicine. I've seen people in A&E that have shouted, that have sworn, that have left when you're in the middle of talking to them, that really don't care. That's very different working on this COVID ward. The number of times that people thanked me for being there was so many, not 2, not 3, but 4, maybe 5 times, saying, thank you for everything that you've done, everyone on the ward. So the healthcare assistants, the nurses, the physios, the pharmacists, the doctors, everyone in the hospital saying, you know, if you weren't there, I don't think I would be here still. They appreciate how well they were, and they're so grateful to the staff that have looked after them. So the reason that I wanted to bring that bit up, I know a lot of healthcare professionals are on this page, and that should keep us going, because I know it's been tough, it's been grueling, hard work, but you are making a difference, and people on the ground are so grateful for everything that we've been doing. Ultimately, let me sum up my reflections like this. I worked on the COVID ward for the first time this weekend, looking after the COVID patients, and they are incredibly grateful for everything that hospital staff are doing. But as a doctor and as a healthcare professional, you feel so helpless about how much you can actually do to help these people and to fight this disease, which is still so new. The patients on that ward were so much younger than I imagined them to be, and I found that really difficult to come to terms with, and is something that I think people need to appreciate more. It doesn't matter if you have lots of health problems or no health problems. It doesn't matter if you're 50 or you're 70. Some people are just affected so much worse by this, which is why we all need to be careful. We all need to keep social distancing, wearing masks. A vaccine is on the horizon, so don't get unwell now. And let's get through this. As always, if you're not subscribed to the channel, please hit that subscribe button. Take care, guys, and stay safe.